Good evening. Today is Wednesday, May 6th. Welcome to the weekly live Facebook question and answer forum hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Vickery, Stanislaus County's Public Information Officer. We will both be moderating tonight's live event, which will be recorded and posted to our Stan Emergency Facebook page and YouTube channel.
You won't see us on screen tonight, but you will hear us as we help direct your questions to our panelists.
Tonight, we're making a minor change to the terms of our forum. To allow for more meaningful and effective communication, viewers will be limited to 5 responses or questions. We hope this will prevent spamming comments, yet still allow you to share your viewpoints and ask questions.
Tonight's panelists include Stanislaus County Health Officer Dr. Weishan Payan, who we will refer to as Dr. V, Stanislaus County Sheriff Jeff Dirksey, and Stanislaus County Board of Supervisor Chair Kristen Olson.
Let's begin tonight's panel with Dr. V for an update on the number of cases here in Stanislaus County. Dr. V, where do we stand tonight?
Yes, tonight we're reporting 461 confirmed cases here in Stanislaus County, and sadly we have 2 new deaths to bring our total to 17.
Thank you for that update, Dr. V. How are testing operations going with the new sites in Salida, Keys, and Patterson?
Yeah, so we're really excited. This week on Monday, we opened 2 new testing sites, one in Keys and one in Patterson. These are not drive-through testing sites. They are in a building and you walk in. So each of these sites you can sign up for. The link is on our website. And so you have 3 sites to choose from the 2 different links. And then you put in your information and you get an appointment. And then you go in for your testing. So at these 2 new sites, you go into the building and you will get tested inside the building and then leave again. But these tests are for everyone who is symptomatic. So we want anyone who is symptomatic to sign up and go get tested. And they will bill your insurance if you have an insurance to be billed. And I think that's it.
And free to those that do not have insurance.
They're
right?
not supposed to be charged at the site.
I wanted to ask you about the turnaround time in terms of results.
Yeah, so the turnaround time, they're using commercial labs of Quest and LabCorp, and the turnaround time is going to stay around 2 days.
Dr. V, yesterday we heard about a new public health order. Can you tell us a little bit about the changes and the impetus behind them?
Yeah, so the governor announced on Monday that we're going into phase 2 come Friday morning. So that opens up curbside retail, the manufacturing that goes along with the curbside retail, and the logistics, so the supply chain to do that manufacturing. So curbside pickup, kind of modeled after restaurant curbside pickup, is the vision of what this will be. In addition, in this county, we are opening up a pet grooming, so dog grooming only, as I said at the Board of Supervisor meeting. Cats, certainly large cats in zoos, tigers and lions have gotten infected with this virus. There's been a few house cats as well and become symptomatic. So in the interest of safety for the cat, it doesn't appear that the cat transmits infection to the owner, but just to be more safe at this time, we will just have dogs only at the grooming.
Dr. V, we're going to stick with you for just one moment. Another question. Your team is tracking medical science and data closely for our county and looking at the 6 criteria in the framework provided by the state. What science and data are we considering in making these determinations?
Yeah, so in the first criteria is about testing and contact tracing. So testing, we've been working to increase our capacity mostly for samples and to be able to take those samples from people, the nasopharyngeal swab that we've talked about so many times. And so we were fortunate to be able to get 2 new sites this week, and each of those sites can do up to 132 people a day, so that's a nice increase in our capacity to get those samples for testing. Another part of that is the contact tracing, which is so important for us to be able to open up more business and be safer leaving our homes. So we've had to stay home for now to be able to get the virus spread down to a level at which we feel like we can control the spread of the virus. And the way we control that spread is through quickly identifying people who are infected, and that's why I would like people with symptoms to go in and get tested so that we know, and we can you can stay home for that time that you need to stay home so you're not spreading it to your family and your loved ones. And then what we do is we find out who your contacts are and get them in quarantine and keep them away from others, and that's how you stop the spread. If we can do that really well, we will be able to expand the activities that we can do that are available for us in this county, which means expanding businesses that are open. But it really depends on us being able to test widely, trace those contacts, and people who are sick or may become ill away from others, make sure that they know that, so that they know as soon as they get symptoms, they go in and get tested. It's a whole process of trying to keep that virus from spreading so that we are safer leaving our homes.
Thank you, Dr. V. Let's go to Supervisor Olson. Yesterday in our Board of Supervisors meeting, you mentioned that we will soon begin opening additional businesses on May 18th, perhaps. Can you provide any additional information about what businesses we are considering and how that determination will be made?
Sure. So we're in a stage right now, actually we've been working on it for weeks, of figuring out how and when we can safely reopen various businesses and activities in Stanislaus County. A lot of business leaders and faith-based leaders and others have worked hard on these plans for how we can, again, safely reopen businesses and activities. And so our goal is to be able to do this with as many different sectors as possible by or before May 18th. We're actively working on those plans. We hope to have more information, or we plan to have more information at next Tuesday's Board of Supervisors meeting related to the timing of when these various businesses could open, the standards under which they could open. But one of the components of this is waiting for further guidance from the state. And that has been a little bit frustrating because the information we've been receiving keeps changing day by day, sometimes hour by hour. But the good news is we've been told that tomorrow we can expect written guidelines from the state of California as to the criteria by which the metrics we can measure to determine when we can reopen. So that will help inform the plan that we bring to the Board of Supervisors next Tuesday that will discuss when we can open various businesses safely. And again, we hope to be able to do that by or before May 18th, but we won't know for certain until we get this guidance from the state.
Kristen, we'll stick with you for just a moment. In addition to businesses like dog groomers and curbside pickup for retail opening, many people are ready to engage in outdoor activities. What can you tell us about parks, reservoirs, and summer outdoor activities?
Yes, so we had good news announcements on the outdoor activities this week. Most of it was clarification of the existing order, not necessarily related to the new order that goes into effect this Friday. But we did want to make it clear that if you are engaging in social distancing, if you're practicing social distancing of 6 feet or more, then you can engage in outdoor activities with members of your household, whether that's visiting a park, whether that's playing basketball with members of your household or tennis on a court. Again, with members of your household, Modesto Reservoir will open on May 16th. We were able to announce that this week for boating and watercraft activities. The shoreline will remain closed, but for boating and watercraft, fishing, water skiing, etc., that will open on May 16th. And then we will be able to open Woodward Reservoir on June 6th under those same protocols. So outdoor activities, there's a lot of options now as long as people are practicing social distancing.
Supervisor Olson, I have another question for you along the same lines. Speaking of outdoor activities, several photographers have reached out to us asking if they can resume their photography businesses, taking photos of families or graduating seniors outside with 6 feet of distance between them. Can you address that?
Yes, the key is being outside. So in-studio photography would still not be allowed under the state or local orders. But if people are outside, as long as they're able to practice that 6 foot social distancing, so 6 feet between the photographer and the individual being photographed or the family being photographed, we don't see a problem with that. That is consistent with the orders for outdoor activities.
Thank you, Kristen. This next question is for Sheriff Dirksey. This is coming in from our live Facebook feed from Dorothy Dutra Shuping. Is the border between California and Oregon closed or open? Because Dorothy is hearing different answers to that question.
Yeah, the border is open. The border between states is open. You can still travel on the road, just like it is between all the counties in California. There is no restriction on your ability to move.
Sheriff, I have another question for you, sort of related to the last one. We know from hearing Supervisor Olson mention reservoirs, soon our reservoirs will be open, but we also know that shoreline gatherings are prohibited. How do you anticipate preventing shoreline gatherings?
Well, obviously if they're closed, we don't expect anyone to be there. The intention is that you're going to have to go into the reservoir with a watercraft, a boat, a jet ski, whatever the case may be, and obviously be out on the water. Our team that's out there, if they have to make contact with anyone, we're just going to tell them to get back on their boat, back on their watercraft, and go on about their water activities. I've said from day one, we're not arresting anyone over this. We're not making criminals out of Americans over this. So we will continue to do that. All that we ask, do the right thing. Do what you need to do to prevent this from spreading.
Thank you, Sheriff. This next question is for Dr. V. Many people believe that the stay-at-home order should remain until there's a vaccine or reliable antibody testing. What are your thoughts on this, and what is the status of antibody testing in Stanislaus County?
Okay, well, the problem with trying to stay home until there was a vaccine, if it was going to be available soon, that would be a good plan. There would be nothing wrong with that plan. It would work. But we really don't know if or when a vaccine will come. There are quite a few diseases that they have just not been able to develop a vaccine for. So while I have hope, and I truly hope we'll get one in the next year, we don't know. And so we can't stay home for the next year. That's just not possible. I mean, we need food grown, and we need so many different things, and kids will grow out of clothes, and there's so many things that we need to do. You need to pay your rent, you need to pay your electrical bill. It really isn't feasible to stay home for a year and wait for a vaccine, it's going to take time. So while a really good plan, if we had a vaccine being manufactured and coming soon, that just isn't the state that we're in. Antibody testing the antibody tests aren't terribly bad. I mean, there's some bad ones out there, but there's also some ones that probably aren't that bad. The problem is that tests don't perform well when very, very few people have a positive test, those rare diseases. So we don't have a lot of people who would test positive on an antibody test right now because we haven't had a lot of people become ill yet. It seems like it, but it really isn't that big a proportion of our population. So right now, only about, I don't know, it's certainly going to be less than 5%. I mean, many studies in California have put the number at less than 5% in places that have had more infections than our county. So when we have that few of people who should test positive, the tests just don't perform well. There'll be a lot of false positives. So it's really hard to interpret if we get it here. So the problem lies more with the fact that right now this is rare. Again, antibody testing isn't for diagnosing acute disease because it takes at least a week to develop antibody. Antibody doesn't come right away. Your body, your immune system has to develop that antibody, and then it has to be at a high enough level to be detected. So there are so many things about the antibody testing that the time just isn't right now for it. It will be sometime, but now isn't the time.
Thank you, Dr. V. Here's a Facebook question that relates to slowing the spread via contact tracing. This viewer asked, how far back does contact tracing go when someone in the county tests positive, and does it include testing? For example, the Turlock Nursing Facility, it appears residents and staff were tested. Were tests or monitoring also given to the families of staff that may have been exposed?
So if there are people who are exposed, what we do is we have a person who tests positive, and then we find out when their onset of symptoms was. So, I mean, we go by onset of symptoms, and then we go 2 days back. So we start our contact investigation 2 days prior to the symptom onset because we know that's when they start becoming infectious. And then we do it until we have the positive test and put them in isolation. So then we find out who were the contacts during that time. So that is our protocol for contact tracing. So yes, it's still in process in many places, certainly in the Turlock Nursing Facility, that is still ongoing. But yes, that is what we do.
So we heard this week Governor Newsom announced contact tracing training, a virtual training. His goal was 20,000 people trained to do this work. Will that benefit us here in Stanislaus County?
So yes, so they are setting up, it'll benefit us in a couple ways. So one is they're setting up a training program, which is great. So we will be able to use it in our county to train our own staff. So that's nice to have free training available. A big benefit to our county. In addition, the staff that they are training up at the state level will be available to be used by the county as well. So it will benefit our county.
Thank you, Dr. V. This next question is for Kristen Olson. You've been working to champion support of our local businesses. What is the status of the microgrant funding the county approved a few weeks ago?
Yes, we're pleased that all of those microgrants have been awarded to the businesses who are eligible to receive them, which was almost 400 businesses. So almost 400 of the applicants were able to receive these $10,000 or up to $10,000 microgrants, which we're so happy about. The thank you notes we've gotten have been very heartwarming. The level of need in our community, as people know, is just tremendous. And so it was just a little thing that the county and the private sector could partner on to be able to help small businesses during this time and hopefully provide them a bridge to larger federal and state assistance. But all of that money is out, it's been awarded, and it should be in the small businesses' bank accounts at this time.
We'll stay with you for a moment, Supervisor Olson. A lot of questions are coming in about camping and outdoor activities. Can you answer this one? Is Knights Ferry open?
That's a very timely question, actually. Knights Ferry is not open. I assume they're referring to the park, the picnic areas. That actually is a state facility, not a county facility, even though it's within Stanislaus County. And my understanding is it is not yet open. We've had some challenges in Knights Ferry recently. A lot of reports, a lot of complaints about crowding on Main Street, down in the picnic areas. And so signs did go up today, actually, by Stanislaus County Public Works, encouraging people to practice social distancing, reminding people that that state park is not yet open. We look forward to it opening soon. We know that's a very popular destination for a lot of us who live in Stanislaus County, but it is not yet open.
Thank you, Kristen. I'm going to shift over to Sheriff Dirksey. This question has to do with some of the protests we've seen. As the shelter order has continued, some people have grown more frustrated. Some cities have seen protests. Is that occurring in our county at all?
Yes, we have had a few protests. They've been fairly small, people expressing their First Amendment right. They have been peaceful. We certainly respect that. And there's been no law enforcement action around them whatsoever because they are doing exactly what the Constitution allows them to do. And so we've had zero issues with any of them and with any of the groups that have done that. And I will tell you on behalf of law enforcement, we certainly appreciate that.
Sheriff, when you were here before, you mentioned that certain crimes were on the rise. What do our crime statistics look like now?
Yeah, we have seen specific crimes go up, or specific categories is probably the better way to put it. We have seen a slight increase in shootings, and this is kind of like the gang drive-by type shooting. Really a fairly small statistical increase, but they are up. And when I say they're up, I'm talking specifically April versus March. So while we have been under this order, I will also say that all of our crimes are still under the 5-year average, so that's good. But shootings are up slightly. General assaults are probably the single biggest one that has gone up. They're up by 25%, which is the biggest increase that we've seen across the board. And that's kind of a broad category of the assaults. And a lot of them are focused really around families. I've talked before that domestic violence is up. Domestic violence in and of itself is kind of even, but what we're seeing a lot more of it, we're lumping it together, but it's family violence. So it might be a father versus a son, a mom versus a daughter, something like that that doesn't meet the criteria for domestic violence itself, but family violence is up. Like I said, the general assaults are in that 25% category. Other crimes against children are up about 10%. Disturbing the peace and suspicious activity are both also up about 10%. Now, suspicious activity is kind of a broad category. In and of itself, it's not a crime. It's a category that we use to track things that may or may not be a crime, kind of depending on the extent of the investigation, but we've also seen an increase in that. So yes, in those areas specifically, crime is up. Property crime, which spiked kind of early, has kind of leveled off, and so that's a great thing. I know that at the Sheriff's Department we've done almost 2,000 extra patrols just since the governor's order went into effect. I would attribute that, and really I attribute a lot of it to the community. Everyone is looking out for each other, they are calling, and we appreciate their help in keeping the crime down, and specifically around the property crimes.
Thank you, Sheriff. This next question is for Dr. V. This comes from Joe Harris. Joe would like to know, what would happen if we open everything too early and numbers spike? Would it mean another potential stay-at-home or lockdown, was the phrasing?
Yeah, so our plan is what we hope will happen is that things will open up slowly enough, right? We're not planning to just open up everything, go back to what we were doing before, and, everybody stop social distancing and stop washing your hands and, do all those things that will really increase the spread. So what we're looking at is more of a slow opening and then carefully watching our numbers and working hard to keep the spread contained with the contact tracing. And then just it's really all about the monitoring and seeing how far we can progress with opening. So that's the science and the data that we continue to try to watch and monitor as we move forward. So that's how we will do it. Will we have to just stay where we are? Will we have to make the restrictions come back in some way? Do they have to go all the way back? Do we just have to pull back a little bit? We just really, hopefully we can watch our numbers closely enough that we don't have to go all the way back to where we've been. And with that stay-at-home order in place pretty broadly, I'm hoping we don't go back to that. But it's just going to depend on how well we do as we open up. So that's really what the answer is.
Thank you, Dr. V. If we're talking about opening up potentially additional business sectors under modified guidelines with safety protocols, what would those modifications generally look like?
So we need to make sure that we stay 6 feet apart from everyone at all times, right? So if that means that in restaurants the seating can't be quite so close, that might be what it looks like. Just things like that. The modifications that we need to take to keep ourselves physically distanced. So if someone happens to cough or sneeze, you're not right next to them and in the line of the cough or sneeze. So really that's a lot what it has to do with. We'd like hand sanitizer or hand washing to be readily available when we're out, people to be mindful of that. It would be great if people wore their face coverings so that if they do sneeze, it hopefully contains a lot of those droplets and decreases the spread. So the new normal will just look like a lot spaced out, I hope, keeping us very much further apart than we're used to doing, making sure when we stand in line we're keeping a distance from the people around us. Things like that is what we're looking at.
Thank you, Dr. V. I'm going to skip over to Kristen. We're getting a lot of questions right now regarding camping and when camping will be permitted, and also about when community swimming pools can open. Can you address those?
Yes, so on the camping question, we don't know when state campgrounds or private campgrounds will reopen, but we are looking to see when we could open camping again at county parks. So we don't have a specific date that we can share with people yet, but we are hopeful that this could be in an earlier stage of reopening. As long as people are camping within their households, practicing social distancing, we're hopeful that this is something we could safely add to our reopenings already fairly soon. Again, we're making all of these decisions based on our local data, very objective metrics, medical science, many of the aspects that Dr. V walked us through at the Board of Supervisors meeting on Tuesday. What does our bed capacity in hospitals look like? What do our ventilators look like? What are our rates of spread? And right now in Stanislaus County, we're in a good place. We have to continue to monitor that, particularly once we begin to slowly reopen various activities and businesses. We want to make sure we don't have upticks that we can't accommodate. But right now we're feeling pretty good about it. And so we're hopeful that camping will be coming fairly soon. As it relates to swimming pools, obviously if it's in your own home, you can swim in your own pool, but we have received a lot of questions about pools at apartment complexes or within homeowners associations. These are a little bit trickier. As long as social distancing can be practiced and people are maintaining swimming activities within their households and not interacting with members of other households or family units, then that would be okay. That's easier in some places than others. So if there is a lot of interaction where 6-foot social distancing can't be practiced, then that would be problematic. But in an apartment complex or an HOA where that social distancing is easy to achieve, then that would be okay.
Supervisor Olson, a lot of people are asking questions about the outdoor movie theater concept that we have proposed allowing in the new order. Since we don't currently have an outdoor movie theater, how would this work? And do you know how people can find out more about where these theaters are?
Yes, we have had a lot of questions and confusion surrounding this issue, a lot of sarcasm and jokes surrounding it as well, and I get it. Those of us who were born and raised here and grew up here remember the series Drive-In fondly, and another one on McHenry Avenue, I think it was. Those are not the types of activities that we're talking about. We understand that we don't have your traditional drive-in movie setting in Stanislaus County. What we're referring to are requests that we've received from a number of different businesses and organizations who would like to host an event in their parking lot where people could drive in. There would be a large screen TV, and the feed from the movie on that TV would be fed through their car radios. Very similar to the drive-in church concept, which we've seen a few churches in Stanislaus County do. So one example, I know there's a local theater in town that is talking about having one of these drive-in movie experiences in a church parking lot. We've had similar inquiries from Vintage Fair. Could they host in their parking lot one of these drive-in movie activities? Perhaps in the parking lot of the fairgrounds, there's been some interest in that. So that's really what we're talking about, creative, innovative ways to provide people in our community with a fun activity, a unique activity, in a safe way in a parking lot. Oh, and I should say, people who are interested in hosting one of these need to submit a plan to Public Health. It will be reviewed. Actually, I think it's to the Sheriff's Department. It will be reviewed and given approval. They need to submit that plan at least 2 days in advance of the event, and they can submit that to an email address that is probably going to be put up on the screen, and that is covid-19info@schsa.com. So they can simply submit their plan to that email address. They'll get an approval or suggested modifications, and that event can proceed.
There were some restrictions regarding the drive-in movie theater concept. Do you want to speak to that for a moment?
Yes, thank you. There are restrictions, again, similar to the drive-in churches concept. People need to stay within their vehicles. No food service or other sales are allowed on site. There will be no bathrooms on site. Again, the whole goal here is to be able to practice social distancing, stay within your households, but have a fun experience at the same time.
Thank you, Kristen. This next question is for Sheriff Dirksey. This is a follow-up question, actually, from Dorothy, who had asked about travel earlier. Dorothy is asking, do you get stopped at borders to find out why you were actually traveling through from state to state?
No, certainly not in California that I'm aware of. I've not heard of that. I've not heard of that in Oregon, which I think was the earlier question. So I have not heard that. I do know that in some of the other states, mostly in the southeast, I think it was like Louisiana and Texas and Florida, there were some areas where they were doing that. I find it hard to justify that, but they were doing that. And so it's certainly not happening here.
Sheriff, last month you had to release inmates in response to a decision made by the Judicial Council of California. What have been the impacts of the zero bail releases? And as this virus drags on, do you foresee more releases?
Yeah, so we talked a little bit earlier about some of the crime stats and where we're at. And there has been an increase, certainly in a number of crime categories. And with the zero bail, that there was an initial group that was let out, right around 150, that were in custody at the time, and then subsequently, as a result of the JCC's decision, they met the criteria for zero bail. Well, since then, we are now up to 434 inmates that we've released as a result of zero bail. Now, it's still that same 150, and then the balance of those have been subsequent cases, right? Someone has been arrested since that went into effect, and their crimes now qualify for zero bail. Now, let's understand that a lot of these folks may have been able to bail out even under the original cash bail that was in effect. So it's hard to say that they were all released as a result of zero bail, but 434 have been released with no bail. Will that continue? Yes, it will continue as long as the JCC's order is in effect, which is for the duration of the state of emergency plus 90 days. So to that end, if the governor changes his order, this statewide order, and lifts some of the restrictions that are currently in place with this stay-at-home order, and maybe you can go to a group of 25 or something, that does not change the state of emergency that we are under. I expect that will continue for months, and then even when it does end, that will stay in effect for 90 days past that as it stands. Now, the Judicial Council of California, that's what the JCC stands for, they put that order into place, and they can subsequently change it if they receive the guidance or the desire to do so.
Thank you, Sheriff. This next question is for Dr. V. We here in Stanislaus County had a recent outbreak at a nursing and rehab center in Turlock. What new measures will be in place to prevent the spread of COVID-19, and specifically within vulnerable populations like nursing homes?
Yeah, so it's really hard. This is all really hard, as we all know, but these facilities where older people, because as I say every week, age is the biggest risk factor for severe disease. The older you get, the more likely you're going to have severe disease. So we know that these are people that need to have extra special protection around them. And so already visitors weren't being allowed in, and there were many measures in place to protect them from this virus being introduced. The problem is that there's enough asymptomatic infection, so people who have no symptoms, so they don't know they're infected. It can be a family member, because there still is end-of-life visitation allowed. There are reasons that you can actually go visit. Healthcare workers, people who work there, can have infection and not know it. People who get transferred in can have infection and not know it. So it's pretty much impossible to keep this virus out, which is the hard part. So what we really are trying to do is early detection. So some of the measures that we've taken to try to keep the virus from getting in is ensuring that everyone who comes in the door is screened for symptoms and has their temperature taken. So that was happening with staff. It's happening for the most part. I had a health officer order last week, and so making sure that everyone walks in, including all the first responders. So most of them are getting screened every day at start of shift, but not quite all. And if you're calling 911 and need someone to come, you don't want to stop them at the door and quick take their temperature. So ensuring that they're screened at the start of their shift for any signs or symptoms is helpful. So that's one of the things that we've done. Another is trying to ensure that early detection. So anyone who has symptoms is immediately placed into isolation, and testing is done immediately. Within 24 hours, the sample is taken. So those are some of the things that are put in place for all the skilled nursing facilities in our county. And we hope that while we know we can't completely keep it out, that's just not possible, sadly. We're working to get early diagnosis so we can try to detect it before there's a lot of spread.
Thank you, Dr. V. There are a lot of mixed emotions about us starting to approach opening some things up. And one of our viewers, Leilani, asked if our numbers in the past week have been plus 20, plus 11, plus 17, plus 5, and then up 28. How can you responsibly open up when our numbers aren't even leveled much less on the decline? Can you address that?
Yes. Yes, so that does look not very level or declining. But the way I look at it is we are looking at community transmission, because opening up is increasing the mixing in the community. So if we take out those numbers from spread inside a facility and look at our community spread, our numbers are actually very stable to decreasing. We may see an increase soon because we've really increased our capacity to test. And so that might finally detect more people who are infected, so the numbers may increase. That's not a bad thing, because we're trying to go for this early detection, isolation, quarantine, contact tracing. So that's good, but it may look like our numbers are increasing, number one. So what we like to look at to be a stable measure of infection and transmission in our county is hospitalizations. We have pretty good and thorough testing in hospitals, and that is something that stays pretty standard across a county. So the amount of people who will get hospitalized with disease is a pretty stable number, the proportion. So our hospitalized have not increased as of last Friday when I last looked. So we're going to be looking again this week and looking at how it looks for our hospitalized. I presented this at the Board of Supervisors on Tuesday, so I invite you to go, because I go and watch it. It is recorded and you can find it. Because I presented these data and a lot of other data showing our syndromic surveillance and showing our percent positive tests. And these are all the measures we're watching that are indicative of our community transmission. So the data looking at how safe it is to begin mixing a bit more in our community are what I'm looking at.
Dr. V, I'm going to stick with you for just a moment. This question came in from the West Turlock Neighborhood Facebook group. They're asking, when will the zip code and ethnic breakdown be available?
Yeah, so we're planning that to go live on our website tomorrow. We've got the dashboard built, and I believe it's ready to go. They were doing some last-minute fixes this afternoon, so I think it'll be ready and up tomorrow. So go see the website tomorrow. StanEmergency.com is one way to get there. There's many ways to get there. So, and you should be able to see that data sometime, try around noon.
Let's go to Supervisor Olson. I know you have regular conversations with other county supervisors about our county's response to this pandemic and comparing what other counties are doing. How does our response compare, and are other California counties opening the same things at the same rates?
There is quite a bit of variance from one county to the other. Even though we're technically under a statewide order, we have seen different counties interpret the statewide order in different ways. And so therefore, from one county to the next, things might look a little different as to what business or activity is open. Most of the big things are generally the same right now. We have 3 counties who have moved toward reopening to a much larger degree. But most of us, and certainly us in Stanislaus County, we're eager to get guidance from the California Department of Public Health tomorrow on what the criteria is that we need to be able to provide metrics on in order to begin a reopening of our local economy more quickly. We believe, based on the data we're receiving from public health, the guidance that we're receiving from public health, that we are to the point where we could safely reopen some additional businesses and activities with, of course, strict social distancing, sanitation protocols, PPE, etc. But we're waiting for those metrics from the state to see how quickly we can move. As I said earlier, a lot of the processes and the information that we've been receiving from the state has been changing every day this week. And so once we get this written guidance tomorrow, we'll have a lot more guidance to help inform our reopening decisions. And we do plan to bring that information to the board on Tuesday to show people how quickly we may be able to safely reopen more businesses and economic activity here in our communities.
Thank you, Kristen. I wanted to make a quick reminder to our Facebook viewers. For those of you who may have tuned in late to this feed, once this posts, we encourage you to go back and watch the video from the beginning, as your question may have already been answered. I want to turn now to Sheriff Dirksey. You touched on this earlier when it comes to the release of inmates in response to a decision made by the Judicial Council of California. Of those released, how many people have reoffended?
Yeah, so in the last, I think it's 4 weeks now, we've had 34 individuals reoffend. And of those, some of them have reoffended multiple times. I think our record is 3 or 4. I don't remember off the top of my head. And then we've had a couple that are multiple reoffenders. So in 4 weeks, they've been in and out of custody now 2, 3, or 4 times for some of these individuals. And obviously that is clearly doesn't do anyone any good in our community. So these folks need to stay in jail. By way of an example, last night law enforcement was in a pursuit of a suspect in the Empire area, and that suspect almost hit a couple of my deputies. Subsequent pursuit, and then he ran from the vehicle, and fortunately he's not faster than one of our canines who took him into custody, or apprehended him, and he was subsequently taken into custody. So he's now back in jail, and he should stay there now for a good while because he racked up some fairly serious charges. But this doesn't do any good for our community. This doesn't keep us safe. It's not good for the public, and it's not good for my staff that has to go deal with someone that should be in jail.
Thank you, Sheriff. While we have you, this is sort of an unrelated question, but we'll just shoot it anyway. Patty asked on Facebook yesterday, I believe it was, about fireworks. Has there been any discussion about allowing the TNT and Phantom fireworks fundraising booths to operate as usual this summer? For a lot of schools and nonprofits, it's their biggest fundraiser of the year, so they need to begin planning.
No, absolutely. We've actually had quite a few discussions about that. We are well aware of what those fundraising events do for so many activities and events and groups across our county. And we are actively looking at how it is that we can make sure that there's a good plan in place for them to sell the safe and sane legal fireworks so they can continue to support themselves. I would expect that by next week we're going to have that in place and we're going to be able to put that out.
Thank you, Sheriff. This next question is for Dr. V. We're getting a lot of questions about dentists, dental hygienists, orthodontists. Michelle Dunn is asking, when are dental hygienists able to go back to work?
Yeah, I've been hearing a lot of questions about that lately, and people keep contacting me. Dentists are under the direction of the state dental director and the California Dental Association. So I am not issuing any guidance to dentists. That is up to the state to issue that guidance for dental practices.
Thank you, Dr. V. A lot of people looking for guidance on things they're unsure about. This one came in from Tina, who asks, our daughter's wedding is scheduled for June 20th for 200 people. Do you think we'll be able to have the wedding, or will we still be in phase 2?
Yeah, sadly, I don't think gatherings of 200 people are going to be allowed anytime soon. I mean, we need to wait and see what the governor's order says, but and 200 is a lot of people. I'm not even sure we'll be at gatherings of 50 by then. So, no, I think it's very unlikely that that will be going forward in June.
Dr. V, I'm going to stick with you for just a moment. Casey wants to know what stage we will be allowed to see doctors for non-emergency appointments.
I actually don't know that either. I mean, there are, what really has been deferred is preventive, routine. So, I mean, the emergency has been going on, and they were kind of moving more to the urgent. So I guess it really depends on what what you need to see the doctor for. Something that's not emergent after a month or two might be pretty urgent, like you should get your diabetes checked. I mean, there's many things that should continue to go on. So I think that's between you and your doctor, and just seeing what exactly, it's almost a person by person question to be answered, I think.
Thank you, Dr. V. Supervisor Olson, did you want to weigh in on that?
Yeah, I will weigh in on that just based on personal experience. I'll tell you, I have been to the doctor 2 or 3 times in the last 2 weeks with either one of my children or myself, which is very unusual. I go to the doctor maybe once every 5 years, but it just so happens we've had to go there a couple of times in the last couple of weeks. And not only have they been open and these were all non-emergency situations, not only have they been open, but we were in 2 different doctors' offices, and they both indicated that over the last week, so I guess now it would probably be 2 weeks, they've been much busier. So it seems that the issue was more about people being concerned about going to places like that, which is understandable, concerned that there will be other ill people, in the doctor's office and not wanting to risk contracting COVID-19. But according to these offices, they are seeing an uptick in patients starting to schedule appointments again. And at least of the places I've been, which again are 2 or 3 physicians' offices, they have been open and available for routine appointments.
We talked about camping, Kristen, a little bit earlier, but we have another question coming in from Rox Bernal. Rox wants to know, do we have a date for children's camp activities or care?
Yes, well, no, we don't have a specific date, but we are very optimistic that this is coming soon. The Bay Area counties are now allowing gatherings of children for activities of 12 or fewer in a group. So again, small summer activities. One example might be swimming lessons, right? An instructor with just a handful of kids for swimming lessons. We expect to be able to allow that soon here. We were hopeful we could include it in this week's order, but with the outbreak this weekend from that large gathering that was unauthorized, we just thought, let's give it another week. Let's take a look at the situation, what's happening. But we are hopeful that children's activities in small groups, summer outdoor activities, will be allowed very, very soon.
Supervisor Olson, we'll stay with you for just a second. The sheriff alluded to the state of emergency and how long it might last, and so many people are, having a hard time with just the unknown, right? It's a changing environment daily. When do you see the governor opening up the economy completely to phase 4? Or do you think the governor will give autonomy to the counties on moving through phases so long as we abide by the criteria laid out for counties?
Mm-hmm. You've spoken to the complexities of the issue. It's just really difficult. There are such a variety of opinions on the subject, and those feelings and emotions and opinions are valid, right? We hear from people who believe we should be sheltering in place with no changes for much longer until there are virtually no new cases of COVID-19. We hear from others who want to aggressively reopen everything and return to life as normal tomorrow. We have to make balanced decisions based on what our local data, medical science, and objective metrics are showing so that we can make sure we have the resources in place to manage any spread of COVID-19 once we begin to safely reopen additional activities and businesses. As it relates to state decision-making versus local decision-making, many of us believe very strongly that those decisions should be made at the local level. We are hopeful that Governor Newsom, when he provides this guidance to counties tomorrow, that will include authorization to make local decisions. And the reason for that is there really is no statewide data when it comes to COVID-19. The data, the metrics, the levels of preparation are significantly different from one county and region to another. And we believe what makes the most sense is to make local decisions based on that guidance from local public health, what they are monitoring on an hourly basis when it comes to our hospitalization rates, our ventilator capacity, our ICU capacity, the amount of community transmission spread, and other data points that, again, are very different in Stanislaus County than they are in LA County, than they are in Mariposa County and Sonoma County. And so because of that, those local officials really need to be empowered to make common sense, smart, strategic, wise reopening decisions based on those data metrics. So again, we're really looking forward to the guidance that's supposed to come out of the state tomorrow that will help inform our reopening plans. And we are asking for and hopeful that we will be given local control to make decisions based on what the science and data in our community supports.
Thank you, Kristen. This next question is for Dr. V, and actually we're getting a lot of questions on this topic, and it happens to be about summer and fall sports programs. When do you think that youth will be able to participate in sports?
That's a great question. I don't know. I'm hoping as we get deep into summer that we can have those sports activities going. I am a bit concerned about the fall. In most respiratory viruses come back in the fall. If you look at the pandemic in 2009, if you look at the pandemic in 1918, starting in August, September, you started to see a lot of infections occur again. I don't know what this virus is going to do. I'm hoping we get a little break for the summer. A lot of people ask me if summer, if it's, are we going to see it go down? It is the question. I certainly hope so. The problem is this virus seems to be so easily transmitted from person to person. It's not going to go away. We may be able to mix more and have more activities. Those may have to not continue into the fall. We really just have to see. We really have to watch our data. So it doesn't really answer your question. I'm hopeful for summer. I'm less optimistic about the fall.
Thank you, Dr. V. We've talked about the outbreak in Turlock a little bit. There's a question from Moni, who wants to know about the gathering where more than 50 people tested positive. Can you provide any more detail on that gathering?
Well, sure. First, I'd like to correct that because 50 people didn't test positive. So it was a gathering of around 50 people, and specifically it was a funeral, which, my condolences to the loss. But this is one of the reasons it just kind of shows why we have said that people shouldn't gather, especially family gatherings, over events. Because there's going to be a lot of hugging, and of course there's going to be a lot of hugging. It's a very hard time, or even if it's a very happy time like a wedding, there's still going to be a lot of hugging and a lot of emotion, and it just, because of the asymptomatic people who can spread, it just leads to spread. And so I just hope that one funeral doesn't turn into many funerals, because that's our fear. This is why these mass gatherings are just not recommended now. We just don't have enough of a handle on this virus to be able to gather like that and be able to hug. And it's really hard and it's really sad, but it's what we have right now, and the way forward to keep us safe, especially if we're talking about a vulnerable population, is just really important to remember.
Dr. V, one more question for you. This has been brought up a couple of times, and it pertains to summer activities. Does pool chlorine kill the virus so that this person in particular can have friends over to swim?
So chlorine should kill the virus. It certainly does on surfaces. I would imagine it would in the pools as long as the chlorine level was high. However, at this time, gatherings are not allowed, and I haven't seen the governor's order yet to see what, we're hoping it comes out tomorrow, but to see what is allowed under the statewide order as it pertains to gatherings. So it might be that after tomorrow you will know that you can legally do this, but as of right now, the order that we're under right now says no gatherings, and so that's what I would say.
Thank you, Dr. V. Next question is for Sheriff Dirksey. Carol Arnold Langley asked, is there a number we can call to ask about what is allowed and not allowed for business? I think there's some confusion out there.
Yeah, the easiest way to do it, call 211. 211, ask for the business branch, and they will direct you appropriately. They should be able to answer any question that you may have, realizing that there's still a lot of ambiguity out there, and there are so many different types of specific businesses. A lot of what we're going to give you is going to be just general guidance, kind of categorical guidance. But 211, or worst case, you can, or alternately, you can just email us, and the email address will be posted for everyone to email, and that will be routed appropriately as well.
Thank you so much, Sheriff. This next question is for Supervisor Olson. Jeremy is asking, what can you tell us about the phases of reopening for churches?
Yes, so we'll know a lot more after tomorrow. What we've heard so far in the governor's plan, I think he's calling them stages. We hear a lot of back and forth between stages and phases, but he has them in stage 3, which I believe it was last week he said we're months away from, not weeks away from. But we're reevaluating that locally. I know they're constantly evaluating these decisions at the state, so we're hopeful it will be sooner than that. There's not a lot we can say in terms of a specific time frame. We're pleased that we've been able to provide some options to the faith-based community at this point. I know many are live streaming their services online. Some have chosen to do these drive-in church services. And we have a group of faith leaders, of pastors of churches, various types of churches in our community, who are working very closely with public health and the emergency operations team to put really thorough plans together on how they may be able to safely open sooner than what we've heard out of the state. So we'll continue to keep people informed. Hopefully it will be sooner rather than later, but we are so thankful for the faith-based leaders who are working really thoughtfully on very thorough plans.
Thank you, Supervisor Olson. Just as a reminder to the community watching at home, we have a lot of people tuning in tonight to submit questions. Some of the questions coming in are very similar, so if you don't hear your name or your question asked, it may have been combined with another similar question. To save time and cover as many topics as we can in the hour, please go back to the beginning and watch again if your question wasn't answered. Next question is for Dr. V. This might be kind of a Facebook rumor control question, but a couple people have asked in the past few days if they should still be wearing masks or face coverings, even though the Surgeon General stated it makes things worse.
Yeah, I think that is a rumor. When this first started, people were buying up all the medical masks, and many of us, me included, came out and talked about the data, and there are actually no data that wearing a mask protects you from getting a respiratory disease. They've tried looking at it with flu. Some have maybe showed something, some haven't showed anything. We really don't have a good answer on whether this really protects you. However, there is increasingly a movement, and there are some data, not much again, about wearing a face covering. So the Surgeon General actually made a face covering video within the last month, I believe, showing how to make your own face covering out of a t-shirt. I've seen people use it. So he is not coming out against face coverings. He is supporting them. They make sense. They're being used for a different purpose. It is to protect others from your sneeze and cough when you are the one wearing it. So it is a different reason that you're wearing it. And it is not using the medical masks, which we need to still keep for our healthcare workers. And so that really was what the rumor was about, I think. I think it was because early on, many of us were saying that, yes, there are no data to show that it protects you. So that I think is what people are referring to.
Thank you, Dr. V. This next question is for the sheriff. This is from Liz Tabor. She wants to know whether Stanislaus County will follow Ventura County in removing COVID patients from their homes if they don't have a place to isolate themselves in their own home.
In removing them from their homes, if we do have some hotels that are available if people need housing, that is certain. We have vacancy in those hotel rooms, but no, we are not arresting anyone if that's what the question is. No.
I think we only have time for maybe one more question, so we'll direct it to you, Supervisor Olson. Lots of questions tonight from the Facebook viewers on when bars, hair salons, and gyms will be able to open. What is the county going to do about these issues, and when will we know?
Yes, we get this question, I would venture to say 100 times a day, and probably there are many of us getting these questions 100 times a day from restaurants, bars, hair salons, gyms. Those seem to be at the top of the list, but there are others too. And we want them to know we're just as frustrated as them. This is a difficult time, and we do understand that. We're talking about these very sectors every day. Business leaders have worked very hard on putting safe reopening plans together for these types of establishments. And where we're at now is looking forward to the governor's guidance tomorrow, What we are asking for is that he give us objective, reasonable metrics, that he allows us to work on meeting those metrics, to meet that criteria, and then he empowers us to make local decisions based on the data and the science in our communities and whether we've been able to meet that criteria he lays out. Assuming we receive all this, our plan still is to take a more comprehensive reopening plan to the Board of Supervisors next Tuesday, May 12th, and to be able to safely reopen as much as we can by or before May 18th. Now, if this is not what we get from the state tomorrow, then we will have to at that time consider what options are available to us. But our goal is to be able to safely reopen as much of our local economy as we can by or before May 18th. That won't include everything. As we've heard from Dr. V tonight, large gatherings of people, we're not to the place in our community where that is safe. We have to be smart, strategic, and data-driven about the decisions we make. But we are hopeful that we can reopen many more businesses and activities under safe protocols of social distancing, PPE, and sanitation just as soon as we can, and hopefully before the 18th of May.
Thank you, Kristen. That's all the time we have for tonight. We want to thank all of our panelists for being here tonight and answering questions directly from our community regarding COVID-19.
We also want to thank our stellar sign language interpreter for helping us out at home, and for those of you sending in your questions. If we didn't get to your question tonight, we'll continue to answer them online, in the comments, and in our daily updates throughout the week.
In addition to this Facebook page, you can find us on YouTube under Stanislaus County Office of Emergency Services, on our website at stanemergency.com, and on Instagram and Twitter. Just search for the keywords Stan Emergency.
Thanks again. We'll see you next Wednesday for another Facebook Live Q&A at 5:30. Stay safe and have a great evening, everyone.